Hi guys, it's Jessica Stone at Stansberry Research, and I've got Amanda Cuocci of the Health and Wealth Bulletin here. We want to talk about COVID-19 and vitamin D. We often hear you, Amanda, extolling the virtues of vitamin D and sunshine and their correlation. What's the best way to get vitamin D, and why is it important to get it, especially right now?
Well, vitamin D is really important for a lot of our body's basic functions, especially our immune system, which we need to be healthy and robust if we're going to fight COVID. Now, vitamin D, if you've read anything from Dr. Eifrig, you know that he's very much against getting it from supplements. That's because the best and most effective vitamin D that you can get is from the sun. So what happens is the UV light from the sun hits your skin, and it breaks down a chemical compound that then goes and makes vitamin D. So it's really important that we get enough sunlight in our day-to-day life.
Obviously, we often have precautions around sunlight, especially those of us that are very fair skinned. Can we block vitamin D if we use sunscreen? And how do we make sure we get enough if we, have sunscreen in our makeup or naturally wear it when we're at the pool or something?
Right. So that's a really good question. I mean, I burn super easily, so I'm very cautious about how much time I spend in the sun. But the good news is that on average, and of course this changes based on where you live, the time of year, and things like that, but you really only need about 20 minutes of sunlight on about 40% of exposed skin. So some of the ways that you can get that, you don't have to go out for 20 minutes for a full stretch. You can go for a couple of walks, shorter walks during the day. That's something that I know Doc likes to do. He'll go for a couple walks, especially when we were still at the office. He would go on lunch walks and afternoon walks. It's really important also during the summer or during really sunny days not to go out during the worst part of the day. So between about 10 and 2, because that's when the sun's rays are the strongest. That way you don't burn quite as quickly or quite as easily. And of course, one of the things we always tell people is to make sure you wear sunglasses because, believe it or not, your eyes can get sunburn. Sun can do a lot of damage to your vision over time. So.
And children and sunscreen, is there any way to make sure they can get vitamin D but also protect their skin because they're even more susceptible?
Right. And I would say it's probably about the same amount. You certainly want to talk to your pediatrician about, times for them to be outside because it really depends on the age as well. For my son, we use a lot of the mineral-based sunblock because it has less of those really harsh chemicals.
So you still use the baby sunscreen for your
Yeah,
son?
and honestly, we use it on ourselves too because the zinc oxide type sunblock is actually a little bit better for you than the super chemical laden ones. So that just makes us feel a little bit safer and, helps keep him safe as well.
Now, what about people with darker skin? Are they going to have a difficult time getting enough vitamin D? Do they have to work harder? And how do they work with sunscreen in particular?
Absolutely. Well, some sunscreen works about the same for everyone. All it does is block that UV from getting into your skin's layers. If you are darker skin, you're going to have a harder time making the vitamin D, so you will have to stay out in the sun a little bit longer. And actually, one of the things that we really recommend people do is check out where they fall on something called the Fitzpatrick scale. And that's just a scale of how dark your skin is, how quickly you burn, that kind of thing. If you have freckles, if you have moles, stuff like that. And that gives you a more full picture of how long you can be outside safely.
I know that you said Doc Eifrig does not like supplements, but we can get vitamin D from food. What foods should we concentrate on if we want to get vitamin D that way, and how much do we need to eat of it?
So there are a lot of studies out there about how much comes from sunlight and how much comes from our diet. I don't have a really good answer for that. I've seen about 50 to 90% comes from the sun. The rest comes from our diet. But really you want to be focusing on a lot of rich foods, foods very rich in vitamin D. So things like fish, tuna and salmon are really good. Mushrooms are very good, as well as egg yolks. And then there's also fortified foods like milk and cereal.
Amanda Cuocci there. Thanks so much for joining us from the Health and Wealth Bulletin. And if you would like to be connected to her writing, please hover on your screen now and we'll connect you through a subscribe hover link. You can also find us on Facebook, Instagram, LinkedIn, and Twitter, and of course, here on YouTube. Thanks so much for watching. That's all for now.